Hi, my name is Alexander Hodge, and I'm a postdoctoral fellow in the neurology department of the University of Michigan Medical School. My focus is on how abnormalities in the neural circuits that help us develop and maintain skills lead to the development of motor disorders, specifically dystonia. I'm here to talk a little bit about my recent application that was funded by the Dystonia Medical Research Foundation, determining a mechanism of symptom severity in DYT1 dystonia. While we know that specific mutations are responsible for inherited dystonias, including DYT1 dystonia, inheriting those mutations is not a guarantee that the carrier will experience symptoms. Interestingly, we also see this variation in the presence or absence of abnormal movements in different rodent models of inherited dystonias. Some show twisting in specific situations, others have impaired dexterity, while others have no overt abnormal movements. This is despite all of these models having mutations that cause some neural changes, or some changes in the neural circuits, rather, that are responsible for motor learning and skill development, namely in the release of dopamine and acetylcholine. I'm leveraging this variation to determine what neural circuits are simply the result of the mutation and which are specific to the development of abnormal movements. My hypothesis is that not all abnormalities in dopamine or acetylcholine release cause abnormal movements, particularly because dopamine and acetylcholine regulate motor learning. So very specific changes in those two systems together probably lead to cumulative changes that end up altering motor baseline and make normal movement difficult or impossible. By using multiple different animal models and with multiple different mutations that are all affecting the same system, I'm going to be able to highlight exactly which combination of alterations to those two systems and how they interact actually lead to abnormal movements. This can highlight why some carriers might have symptoms while others don't. The idea being the mutation makes you vulnerable, while something else would then trigger that specific pattern of activity, that specific pattern of change in both dopamine and acetylcholine systems. This is important not just because it's answering the basic science question of how do neural circuits produce movements and allow us to learn complex movements, but it's also describing and understanding the mechanism that leads to symptoms for people with mutations like the DYT1 mutation. If we can understand what that central mechanism is and how it translates into symptoms for some people and not others, we can then create targeted treatments that prevent people who would otherwise have symptoms from having symptoms that are as severe as they would otherwise be, or from having symptoms at all. So the DMRF, the Dystonia Medical Research Foundation, has been essential in getting this research moving. Their funding is an integral step. This work is ambitious and somewhat high risk. I'm utilizing multiple rodent models, precise optical techniques, multiple behavioral paradigms, and I'm relying on consistent and quantifiable interpretation of all of that. So because of the DMRF's support, I'm able to focus entirely on performing that work in a consistent, reproducible, and interpretable manner so that more time can be spent later on translating that into something that can actually help patients.